Missouri Governor Mike Parson is asking people to limit the size of their Thanksgiving gatherings as COVID spreads throughout the state. I'm Laura Moritz.
And I'm Kelly Eckerman. The governor is urging families to take precautions.
Our Thanksgiving will not look the same as it has in years past. My in-laws are in their 80s. They both have underlying health conditions. And I am not going to expose them, and my family won't expose them to the possibility of COVID-19 where we don't have to. I suggest each and every one of you do the same thing.
Governor Parson says he won't issue rules to enforce the recommendation. The CDC is urging Americans not to travel for Thanksgiving. It's asking people to celebrate with their households. People who don't currently live in a household in the 2 weeks before Thanksgiving, even college students who are returning home for the holidays, should be considered part of different households.
Public health officials worried that a surge in holiday-related COVID cases could create an even bigger problem for hospitals.
KMBC 9's Emily Hallwick spoke with local healthcare leaders about what they're seeing and potential solutions, and she's joining us live now from St. Mary's Medical Center in Blue Springs. Emily?
Well, the chief medical officer here tells me that staffing is tight and that all 20 beds in their COVID unit are full right now. Staffing shortages are something that we've seen here in the metro and across the state as well as across the country. And doctors here are worried about what could happen if cases continue to go up. Rising hospitalizations are putting a strain on staffing.
My biggest concern is that we will soon exceed our capacity.
Dr. Michael Liston is the chief medical officer at St. Mary's Medical Center in Blue Springs. He says they're considering halting some elective procedures to free up staffing. Another option:
look to other sources of nursing out of state that could possibly come in and back us up during this critical time.
According to Missouri's COVID-19 dashboard, 37% of staffed hospital beds and 31% of staffed ICU beds are available in the state. In the Kansas City area of Missouri, 23% of staffed inpatient beds and 18% of staffed ICU beds are open.
We're seeing near record high numbers of COVID patients.
Steve Hager of the Mid-America Regional Council and Truman Medical Center says some area hospitals could put nursing administrators back at the bedside.
There is some orientation and retraining that has to happen. These are all usually very seasoned nurses, but they haven't necessarily been at the bedside in a while.
He's worried the worst could still be ahead.
I think the trajectory we're on is very scary, and next week with the holidays, I'm afraid of what the next couple of weeks are going to look like.
In his briefing today, Governor Parson said that they're looking at all options, including bringing in nurses and other staff members from other states to help out. Also looking at whether nurses who are currently in training can help out to help lighten that burden at hospitals. Reporting live in Blue Springs, Emily Hallwick, KMBC 9 News.
Governor Parson has extended the state of emergency in Missouri to March 31st. His office says it will make it easier to deploy critical resources around the state and ease regulations to help with COVID-19 response efforts.
The deadline for all Kansas counties to come up with their own mask plan is coming up in less than 6 days. Governor Laura Kelly says counties have until November 25th to take action, and if they don't, they will be opted into a statewide mask mandate. The governor issued a statewide mandate in July, but most counties opted out. Johnson County will continue with its mask mandate in line with the governor's order. The district attorney's office handles complaints about mask compliance. KMBC 9's Bianca Beltran spoke with him about the process. She's live in Olathe.
And Laura, there were a lot of questions today, both from the public and county commissioners, about whether the enforcement plan issued today by the Johnson County Board of Commissioners would apply to the governor's mask mandate. And county officials tell me that the complaints about masks will continue to be handled by the district attorney's office. Now, those complaints regarding the governor's mask mandate can be called into the consumer fraud hotline here in Johnson County. District Attorney Steve Howe tells me they have received 1,400 calls since July. He says an investigator will conduct a site visit if they have received more than one complaint about a business, and so far they have done 18 site visits, but only one business has refused to comply. So none of the visits have resulted in citations so far.
What we have found is through the education process by our investigators going out to on-site visits that businesses typically were either in the process or when we talked to them about the need to do that, were compliant with our request.
Now, the district attorney's office could file a civil action for a business or organization that refuses to comply with the mask mandate, but that would be for a penalty of $100. And DA Steve Howe says that resources are better spent on education. Reporting in Olathe, I'm Bianca Beltran, KMBC 9 News.
Businesses that break Johnson County's rules on public gatherings and curfews could face up to a $500 fine. Cities within Johnson County can choose to participate in this enforcement plan.
12 coronavirus vaccine candidates are in the final stages of clinical trials now. Researchers working on the AstraZeneca vaccine say they expect to report the results by Christmas. In an earlier phase, the vaccine candidate had a strong response in people over 70. The University of Kansas Medical Center and Children's Mercy led the regional efforts of that AstraZeneca clinical trial. Pfizer and Moderna say their vaccine candidates were 95% effective in late-stage trials. Now, thousands of people are taking part in these clinical trials around the world, and today doctors at the University of Kansas Health System were asked, why would anyone want to be part of a trial?
There still is a sense of duty, and just as you stated, even though, for the past few years we've seen a lot of sense of I and me and what I want, it's we the people, and there still is that sense of duty out there. And if you read some of these stories in the media about people and why they're doing it, they say because they feel it's their sense of duty to help their families, to help their community, to help the country.
The health system is one of many hospitals seeing a surge in cases. It has 120 COVID patients. 36 are in the ICU, 13 are on ventilators.
The Kansas City, Kansas Fire Department says firefighters who have been exposed to COVID-19 but not tested positive should continue to work. KMBC 9's Michael Mahoney has more on the dispute over COVID-19 in the firehouse.
That firefighting is dangerous is an understatement. The KCK Fire Department says since the virus hit, 67 members have tested positive. There are more than 400 members of the Firefighters Union.
I think it's creating a potentially dangerous situation for both firefighters and the public.
Union President J.J. Sima. If a firefighter tests positive, it's treated like any other on-duty injury. If a firefighter is exposed but not showing symptoms, they still must quarantine, but they have to use their own sick time. It is not treated the same as an on-duty injury.
If I'm quarantining and I have no illness, I have nothing to put down on an injury or illness on duty form.
Sima says some new firefighters who lack much built-up time off are exhausting their sick leave, vacations, everything.
They may go without pay. They may be docked, or they may come back to work.
Do you know if that's ever happened?
It has happened.
I'm not aware of anybody that's happened to. I don't know.
Callahan says the virus is causing some staffing shortages at firehouses, and they are trying to cover that shortage by shifting around some firefighters. And now the department is ordering firefighters who have been exposed but asymptomatic back into the firehouses, but they have to wear a heavy N95 mask for their entire shift. Michael Mahoney, KMBC 9 News.
The KCK Fire Department and the union are just starting contract talks. The union says the problem with COVID-19 is not a contract issue. President-elect Joe Biden is ruling out the possibility of a national lockdown to address the coronavirus pandemic. He says a blanket lockdown would be counterproductive. Biden says federal officials may work with states about what can remain open based on local trends in the pandemic. Current Vice President Mike Pence says America has never been more prepared to combat the virus than we are today. He also says he does not support a national lockdown.